A hospitalization for an older adult is a very high-risk situation. They're at high risk of losing their functional ability, their cognitive status, and that recovery may not be complete.
When people start getting admitted to hospital as seniors, I think they do feel that it's coming closer to the end. People are scared that they're not going to get to go home again. They're going to need more help from their families or be admitted to long-term care.
We also know that loneliness and social isolation is a big adverse event that occurs in older adults and can be exacerbated in hospital. They often are placed in a bed and things are done for them. But to an older adult, that's actually quite detrimental to their health.
Lots of times people come in and they kind of take on like the sick role. They stay in bed. They don't keep their mind active. They're like, I need help doing everything. And then they just lose things so quickly.
We're often focused on treating the main issue that brought them in, so the illness or injury that brought them to hospital. The issue is, though, our older adults are complex and they have very different healthcare needs. So we're missing things like frailty and cognitive concerns and new confusion and falls. If we don't deal with the multi-complexity, which our system is not designed to do, we end up with very fragmented care and the big picture is missed. ACE stands for Acute Care of the Elderly. These are units that are really specialized in producing high-level outcomes and meaningful outcomes for older adults when they enter the acute care system.
Being on the ACE floor is a different experience. We focus on people as a whole, not just their medical reason on what brought them in, and we keep them well enough so they can go back home.
An ACE unit consists of really 5 principles. The first is a prepared environment. So sometimes our hospital environment really sets patients up for failure, especially older adults. It's little adjustments that really makes a huge impact. The second aspect is patient-centered care. This care takes a multidisciplinary team and turns it into an interdisciplinary team, where we all collaborate on a daily basis to perform a very comprehensive assessment of someone's health and care needs. And then we collaborate as one and develop a care plan that makes sense to the patient. The third element is early discharge planning. So the second that patient enters the unit, we're thinking about discharge. We're thinking about those transitions of care. And we recognize that especially for older adults, transitions of care can be dangerous. The next element is early mobility. Traditional models look at placing patients in bed and nursing them back to health. This doesn't work for older adults. They need to mobilize from day one. The last element is medication review. Older adults not only are at risk of polypharmacy when they enter the hospital because of their many comorbidities, but also at risk of additional medications getting added on during a hospitalization. The medications get reviewed on a daily basis to ensure that they're relevant to the patient's health and care needs, and any unneeded medications get slowly discontinued. Since the ACE unit was initiated, we're seeing the principles of older adult care, those evidence-based approaches, really trickle down throughout the entire hospital setting. Patients are telling us they're overjoyed with the care that they're provided with. They feel very confident at the time of discharge. They feel like they know the plan. They transition back to the community with that plan in mind.
I think that it's working better as the ACE unit because we're getting people up. They're getting back to as much to their home routines as possible. People are getting the attention that they need to be on the move and making sure nothing's being missed.
People are confident here on our ACE unit. They're confident that they will get the best care. They're confident that they will restore their function and cognition, and they're confident they'll get back home.